All right, knock, knock, knock.
Come in.
Okay, I'm going to provide patient privacy. Can you tell me your name and date of birth?
Linda Potter, 9868.
Okay, Linda, well, I'm Jordan. I'm going to check your armband, and I'm going to be doing your physical assessment today. I'm going to perform hand hygiene. Okay, so Linda looks her stated age. Her skin color is a ruddy dark tan, which is consistent with her genetic background. She has no obvious deformities or hearing deficits, and that is cranial nerve 8. Her face is symmetric, and her affect and mood look normal and calm. Her clothes are neat, clean, and appropriate for the season. Um, she was articulate with her speech, and it was appropriate to the context. She speaks English and is giving good eye contact. Her position is sitting up straight, and so she looks comfortable, does not seem to be using any accessory muscles for breathing, and she has no involuntary movements. So I'm going to take a second to look at my thing here. Okay, so her gait was good, and she was not using any assistive devices, and she looks well nourished. Can you tell me where we are today?
You're in my bedroom.
Yes, I am in your bedroom. And can you tell me what the year is?
2020.
Okay, patient is oriented and conscious times 3. So I'm gonna go just straight in here. I'm gonna look at your head if that's all right.
That's fine.
Looking at her scalp, we do not see any little bugs or lice or anything. Her hair is a thick brown and it is short. Okay, now I was feeling your head here. It is normocephalic. Okay. So moving on to her face, she is symmetrical bilaterally. She seems happy and calm. I'm gonna take a second to look at mine. Okay, so I'm also gonna take a look at your hands here real quick. And I can see that they are the same ruddy brown tan color as the rest. And her temperature is even bilaterally. Her nails are clean and neat. And her cap refill was instant. Let's see her turgor here. And it is instant as well, so she must be well hydrated.
Yep.
Okay, so now moving on to your face. Your eyebrows are even, symmetrical, and full. They are dark. Your eyelashes are also long and dark and well distributed. Your nose is midline, and her lips are full and pink. And they do go up at the end when she does smile. We're gonna feel your TMJ joint. Can you open and close your mouth? Good. I don't feel any popping or clicks with that. And now we're going to test your strength. So can you open your jaw? Okay. And now open it. Close it. Good. So her muscle strength is good. I'm going to go ahead and test her next muscle strength as well. So can you turn side to side?
Mm-hmm.
And can you go like put your head on your ears? Okay. So now turn your head to the side again.
Okay.
Other side. Good. And then good. So muscle strength is a 5 and it is adequate. Okay, so can you smile for me? Can you frown? Can you clench your eyes shut? And can you grit your teeth? Okay, so that is cranial nerves 3 and 7, or 5 and 7. Now I'm going to check your sinuses, so tell me if you have any pain or tenderness.
No.
Any down here?
No.
Okay, so now I'm also going to feel your temporal artery. It is a 2+, and we would do that on both sides, so it would be equal bilaterally. So now we're going to move down to the eyes. And so if you could take her, yes, that'd be great. Okay, so her lids are full and they come down to the same part of her iris. Try to keep you in the picture here. Okay. I'm gonna pull, you can look up. Her conjunctiva is pink and moist, and her sclera is china white. Her cornea is clear and moist, and her iris is a pretty green color. Her pupils are about 2 millimeters. I'm going to go ahead and get my light here. Okay, so if you can just look straight at my nose.
Mhm.
Her corneal light reflex is even and symmetrical. Actually, first, can you follow my finger with your eyes? Good. So she passed the 6 cardinal positions test, which is cranial nerve 3, 4, and 6. Now I'm going to test her accommodation. And her pupils accommodate accordingly. And we would also do this bilaterally. So now I'm going to come from the side. I'm going to get kind of close to you, but I'm going to use my right eye to her right eye and find the red light reflex. And follow that all the way in. Okay. And so I could see her fundus, which was an orangey yellow color. I could see the paired vessels and also the optic disc and the macula, which was 2 disc diameter away. And so now we're going to move on to the nose. And looking at her nose, it is even and symmetrical. I do not see any lesions, maybe perhaps a couple macules, which are just freckles. And now I'm going to look up your nose.
I'm sorry.
Don't be sorry. It's okay. I can see the 2 turbinates, and it's pink and moist in there. I see some cilia as well. Everything seems to look good other than that. We're going to test your patency. So can you cover one nostril and take a sniff? Okay, can you do the other one? Nice.
Yep.
Nice. Also, her septum was not deviated. So next we're going to move down to the mouth. And I can see again, I stated earlier, but her lips are full and they're a couple shades darker than her skin tone, and they are pink. And her mood, it looks good. Can you open your mouth?
Yep.
Okay, so her teeth are china white. Her mucosa and her gums are pink and moist. I do not see any lesions. Could you say, Her uvula is mobile and her soft palate rises. Oh, do you have tonsils?
No,
Okay, but she doesn't have tonsils, so I'm not going to grade those today.
they were taken out.
They were taken out. Could I actually look under your tongue as well? Good. The floor of the mouth looks clear. Can you stick your tongue out? Nice. And that's cranial nerve 12. We don't have a tongue blade, but I would gag you, not harshly, but to test your gag reflex. So I wouldn't do that here, obviously. And now we are going to move on to the ears. So for the ears, I'm going to put this handy dandy little thing on, which might take a second. There we go. And so first, I am just going to inspect and palpate your ears. Tell me if you have any tenderness or pain. No tenderness and pain reported. Do you have your ears pierced?
Yes.
Okay, well, she's got 1 hole on each ear. And so now I'm going to go ahead and take a look. I'm going to pull the pinna up and back and use my other hand to brace. I can see her tympanic membrane and her cone of light, which was at 5 o'clock. I can also see the umbo and the mambrium and the annulus in the middle of the tympanic membrane, and the pars tensa at the bottom and the pars flaccida at the top. I did see some cerebrum and some cilia in there, but those are normal findings in everyone's ears. I'm also going to palpate the mastoid process. So if you have any pain or tenderness.
No.
Good. And we would do all of this bilaterally. So next we're going to go to the neck, and I'm just going to inspect. Your skin looks consistent with the rest of your body, a ruddy tan color. There are some macules, but overall no discoloration or lumps or masses. So now I'm going to palpate and just feel around. I'm not feeling anything, so we're just going to go right ahead into palpating your lymph nodes. So we have your preauricular lymph nodes, your postauricular lymph nodes, your submandibular, your tonsillar, your submental, your cervical chains, and your subclavicular. And no lymph nodes are palpable, which is also normal.
Okay.
So next we're going to check your carotid. And that's a 2+, which is normal. And we would do that bilaterally as well as auscultating for bruits, which I'm going to do. No bruits were heard. So that's good. Now we're going to palpate your trachea and your thyroid gland, which is all kind of in the same area. And I'm going to have you take a drink after I move your, oh no, keep your nose straight.
Sorry.
Okay, take a drink. Nice. Okay, take a drink. Okay, and her thyroid gland was not palpable, which is also normal. So next we're going to check your muscle strength. So can you lift your shoulders? Good. She could lift against resistance, which was cranial nerve 11. So next we are going to do your back, posterior chest. And first I'm just going to, you don't care.
Nope.
Well, I can't really see much, but that's okay. No, it's okay. Her skin is warm, both sides. Her skin color is that same ruddy tan as the rest of her body. Girl, you got some sun this summer.
Oh, yay.
Saw
that mowing.
Next, I'm going to palpate and just tell me if you feel any pain
No.
at any point. Okay? So now I'm going to check chest expansion. So take a deep breath in. Out. Good. Her chest expands evenly. Excuse me. And now I'm going to go ahead and auscultate your lungs from the back. Make sure I put this on right. Okay. So just breathe normally. Okay, all areas are resonant. And now we're going to move our way to the front. And as I look around here, I can see that her AP diameter is 1 to 2, which is normal, compared to a barrel chest, which wouldn't be normal, but you don't have that.
Okay.
And so now I'm just going to take a look at your upper chest, noticing the same skin coloration as the rest. And also some more macules here, but that's normal. That's consistent with your skin tone. So now I'm going to palpate. Tell me if you feel any pain or tenderness. Okay. So now I'm going to percuss. And I'm going to start on the back since I missed that one. Okay. And all areas were also resonant. As I'm taking another look at her here, I can see that she is breathing effortlessly and not using any accessory muscles to do that. And now I'm just going to go ahead and go in and percuss the front. Yeah.
Get those fat rolls.
Okay, you can go ahead and lay down if you would like.
Okay.
So I'm gonna listen to your lungs and your heart here.
Excuse me.
First, I'm just gonna start with your lungs.
Mhm.
Okay, and I do not hear any suspicious lung sounds. And now I'm gonna go into feeling your heart, or listening to your heart.
Mhm.
So I'm gonna start here at the second left intercostal space for the apical pulse. Sounds good. Left, right, no left, second intercostal space, which is the pulmonary artery. Now I'm going to go to the third intercostal space for Erb's point. And now auscultating the fourth left intercostal space for the tricuspid. And then the fifth intercostal space, midclavicular, which is the mitral. And all areas sound good. And now I'm going to take a pulse, the apical pulse, which is right here. And that is 2+ as well. All right, I'm gonna take a second to look at my note cards here. So next I'm going to move to the upper extremities. So you can just stay here actually.
Okay.
I'm going to look at your skin here, which is the same ruddy dark tan. The same on this side. And the temp is equal bilaterally. So now I'm going to palpate your arteries here.
Mhm.
So this is your brachioradialis, and that is a 2+. And then your ulnar, which is 2+, and your radial, which is 2+. And I would do this bilaterally as well. So next, can you touch all your fingers to your thumb? Can you do both sides?
Yeah.
Okay, so that's good muscle strength. Can you set up for me? Sorry.
No, you're fine.
You're gonna have to lay down again in a second. But,
Okay.
can you stick your arms out like this?
Mhm.
Can you pull up?
Yep.
Good. And the same way down?
Yep.
Good. So muscle strength is at 5, which is adequate. So next, I'm gonna look at my note cards again. Real quick. Okay, so we're actually gonna move back to your heart real quick.
Mhm.
And I'm just gonna feel this apical pulse one more time. Seems to be 2 millimeters, and it's 2+. Also, I was going to say that the gag reflex is cranial nerve 9 and 10. Yeah. Okay, so now we're gonna move to the abdomen. So
Okay.
you can lay
Lay
back
down.
down.
All right. Okay.
Okay, so I'm gonna lift your shirt if that's okay. So the contour is flat and it is symmetric. Can't see the umbilicus, but I can feel it right here, which is midline and turned inward. So now I'm going to Just look around and see if I see any swelling, masses, or pulsations, which I don't see. And so now we are going to auscultate them, see if we can hear bow sounds. I'm going to start in the right lower quadrant. To the right upper quadrant. To the left upper quadrant. And the left lower quadrant. And while I'm here, I'm going to real quick check for bruits. So left intercostal space, which is the apical, the pulmonary, Erb's point, tricuspid, and mitral. I did not hear any bruits. So now I'm going to lightly palpate. Tell me if you feel any pain or tenderness.
No.
No pain or tenderness noted. Going to also percuss while I'm here. Should hear a timpani sound, which I am hearing. Okay, so now I'm going to deep palpate. So just tell me if this hurts at all. It's pretty deep. Awesome. I'm going to try to palpate for the spleen while I'm here, which is not palpable, which is normal. From the right lower quadrant all the way down to the left lower quadrant. I'm going to palpate for your spleen, which is also not palpable. Okay, so now, okay, she successfully did the abdominal reflex, which is like a little tickle, and then you go, woo! Okay. So now, let's see, we're moving down the body, we're at the stomach. So now I'm going to feel your femoral pulse, which is 2+, and I would check that bilaterally. And also see if I can feel any of the inguinal nodes, which is like some lymph nodes down here. And that is not palpable, which is normal. So now I'm going to go to the lower limbs after checking the precordium here. No pain or tenderness. So I'm looking at the lower limbs, and it's the same ruddy brown tan color, which is nice. I wish I had that. Skin color is consistent and warm on both sides. There are some macules on here, like little freckles, maybe a few little larger spots, but nothing that looks worrisome. So now I'm going to go ahead and palpate for your popliteal artery right here, which is 2+, and I will do that bilaterally. And I'm going to go down here to your posterior tibial, palpate for that, which is 2+, and I would do that bilaterally as well. And I want to feel your dorsalis pedis pulse, which is 2+, and that would also be bilaterally. Okay, so I can see that her legs are also symmetric. And there are no presence of varicose veins. So now can you lift your knees to your chest? Nice. Can you come over and sit on the side of the bed for me? Can you just kick your legs out?
Yep.
Okay, can you move your foot up and down? Okay, now push it up. Good. And push it down. Okay, good. Muscle strength of hips, knees, ankles, and feet are adequate. That's a 5. Next, we're going to go into the vibrations, which I cannot do because I don't have a tuning fork, but I would strike a tuning fork and I would put it on her toe and she would tell me when she could feel the vibrations. So we are not doing that though. Okay. Next, can you go ahead and run your left heel down your right shin? Good. Can you do it on the other side? Good. Cool. So can you put your hands out and can you move them like this? Good. Muscle strength. Oh, can you touch your fingers to your nose? Good. That's awesome. That's adequate. Okay, now can you do that, but also touch my finger? So touch your nose, touch my finger, and keep going. Just with one hand.
I'm great. Sorry.
It's okay. I have to learn how to explain that better. That is good as well. Okay, so I'm going to go ahead and have you stand up.
Okay.
And you're going to close your eyes. I'm going to hold you. We're just going to sit here for 5-10 seconds to make sure that you can be balanced with your eyes closed. But you can. Good. So that's a negative Romberg's test. Can you do some shallow knee bends for me? Good. Her joints seem to be doing well. You don't have any pain in your joints when you did that?
No.
Okay. Okay. Also, can you bend over for me? I'm just gonna feel your spine.
Can you touch your toes?
If you can. I can't. And her spine is inline and midline and symmetrical. So can you turn around and face me again? Can you bend to each side at the spine? Good. What about forwards and backwards? Good. And what about some little twisties? Good. Okay, so her range of motion is very good. Can you walk to the wall on your heels?
Oh, heels. Yeah. Thought you were gonna tell me on my tiptoes.
And can you walk back on your toes? Yes. Her gait looks normal doing this as well. She has very good muscle strength. 5 out of 5. So now we're going to do some position sense. So if you could just sit down.
All right.
Just sit for a little bit. Okay, so you're going to close your eyes and I'm going to move your finger. And when I stop moving, you're going to tell me if it's up or down.
Okay. Down. Up.
Okay. You do your other hand.
Up. Down.
That's really good. Okay, so next I'm going to have you stick out your hand and, sorry. Close your eyes.
Okay.
Sorry. Tell me what I put in your hand. You feel it.
Paperclip?
Yes. Okay, so give me your other hand. Tell me what this is.
Cotton ball?
It is. Okay, keep your eyes closed. Now I'm going to draw something on your hands. See if you can tell me what it is.
Number 8?
It was a number 8. Other hand?
A B?
Yes. Good job. So now I'm going to take a second to look at my note cards. Okay, let's see what else I did here.
Excuse me.
Okay, so now you're going to close your eyes and tell me when you feel a sensation on your face.
No. Yep.
Good. Okay, and keep your eyes closed, and I'm going to be going on your legs and your arms, and you got to tell me if it's either sharp, or dull.
Dull.
Okay, so you ready?
Sharp. Dull. Dull. Sharp. I don't know.
I'm sorry. It's okay. We don't have the actual equipment for this.
Sharp. Sharp. Dull. Dull.
Good job.
Mm.
So now we're going to check your reflexes.
Mhm.
And I don't have a reflex hammer for this, so I'm just going to demonstrate how I would do it.
Okay.
So just relax your arm.
Mhm.
I would hold this part up for her. Yeah, you just relax completely, put your whole weight on me. And then I would hit this part of her, the back of her elbow, and we should get a response. So that would have been a 2+,
Mhm.
and we would do that bilaterally. So next we're going to do the brachial radialis. So I would hit this, and we would get a reaction, little twitch, and I would do that bilaterally. So now I'm going to do her radial. I'm going to relax her thumb here, and then we would hit this part right here, and we should get a response. And we would do that bilaterally as well. And then for her patellar, we would find that little groove in between her kneecap and the front of her shin, and we would strike that, and we should get a response. So then next, we would just have her feet hang off the bed, and we would do the Achilles. So I would just strike the back of the Achilles, and we should get a response in the foot. And then very last but not least, I'm going to do the plantar reflex. Oh, yeah, she got a good reflex for that one.
Oh, man.
Good. So I'm going to check and make sure. Look at, I don't know how many looks I did, like 7. Okay. So I'll help you stand up
All
here.
right. Thank you.
Thank you so much.
Thank you.
I'll see you around.
All
Have a
right.
good day.
You too.